We're talking to Dr. Suhail AlRukn. He is the president of Emirates Neurology Society and also the head of the Stroke Center, Rashid Hospital, Dubai. Dr. Rukn, as the head of the Stroke Center, how would you describe the current state of stroke awareness and prevention in the UAE?
Hi there, welcome. Thank you for the interview. It's my pleasure that we start a nice campaign with the Stroke Media Academy on the 29th of May 2025, looking for building a stroke awareness across the UAE. It has been always a challenge to send the message and the voice of a stroke victim across the media. Nowadays, I'm so happy that we are able to build this relation between the journey of hospital, patient, and the media to build the awareness of stroke case, stroke issues in our community. The number of stroke victim in our community is more aware about. We are having in UAE more than 10,000 stroke victim per year. These patients is annual number, and we need to make our patients, our community aware about these numbers.
You have said we are having 10,000 number stroke victims. What are some of the most significant advancements or milestones which have been achieved under your leadership at the Stroke Center?
When I came back from Montreal, McGill to Dubai and working in Dubai Health Authority at that time, the number of stroke center in UAE in 2012 was zero. No stroke center. Stroke was not on the agenda of the Minister of Health or the health authorities at that time. In 2025, I'm so proud to say that we have more than 16 stroke centers in UAE, advanced stroke center, and that include all the cities and Emirates. There's a stroke center which is everywhere in the cities, more than 6 stroke center in city of Dubai. Second thing is stroke became a top disease on the agenda of the stakeholders for the stroke, on the agenda of the Ministries of Health, of Dubai Health Authority, of Abu Dhabi Health Authority, and other health authorities. Stroke is a disease which start to be very clear that there's a huge challenge and demand, and we in UAE government, different authorities, private sector, governmental sector is working together to help and support our community to be sure that stroke is no more is a challenge and there's a treatment and cure for this disease.
When we talk about stroke, there are a lot of myths and there are a lot of differences. Can you shed light on the difference? What is the key difference between a heart stroke and a brain stroke? And how often are these terms misunderstood by the general public?
Very important question. Heart stroke, everyone will remember that. Chest pain, left shoulder pain, short breath. These are the symptoms of heart stroke, which mean that the blood has been decreased, reaching the tissue of the heart, the muscle. While the brain stroke is something different. It's coming with the symptoms, which is not chest pain. It's include one of the following 5. Facial droop, where patients will have a suddenly within a minutes that he's unable to smile normally, or yesterday night he or she had went to bed normally and they woke up with facial droop. They can have speech problem. That early morning I spoke with my mother, she was able to speak. After noon I called her again, she's unable to speak. About the balance, they will have a problem with their balance, they are unable to walk steady. Acutely, they will have problem with their vision, eye problem, they are unable to see clear. Then the arm weakness or the leg weakness. This morning, she woke up for Fajr prayer, she was doing good. Then she's unable to stand or to walk or to use the arm. These are the symptoms that we call it be fast. Balance, eye, facial droop, speech problem, arm weakness. The T is time is brain. You need to go as soon as possible to the nearest stroke center. And my advice to your audience, please call 998. because they have been trained. Ambulance service, national or Dubai ambulance, they have been trained to take the stroke victim to the nearest stroke center in the city. Don't take or drive your beloved to a hospital which is not a stroke center. Dubai ambulance, national ambulance, they knows where to take these patients.
Could you elaborate on the Emirates Neurology Society role in raising awareness and improving stroke care across the UAE?
Our society, as the president of Emirates Neurology Society, over the last 10 years, we have been heavily involved in building stroke awareness in the community through campaign in the community and in the hospitals, doing a public awareness with the journalists, with the newspaper, with the social media, coming on the national TV, speaking about stroke, getting an international conferences to UAE to speak about stroke update. Last thing is to get the World Stroke Congress 24th last year in October in Abu Dhabi City. That was the largest ever stroke campaign, happened with more than 3,500 doctors, physicians, nurses, rehab specialists, and patients gathered together in city of Abu Dhabi in October 2024.
We see you are doing a lot of initiatives in educating people and for the stroke prevention and the response. Coming back to, you have just mentioned that a rapid response and the treatment is extremely important for the stroke victims. So, how is the stroke center one of the leading centers in the region ensuring this response?
Very nice question and very important question. I'm so proud that with the governmental leadership, UAE became the crystal or the diamond of stroke care in the Middle East, the first accredited stroke center outside Germany by the German stroke criteria for stroke center accreditation was in 2024 in city of Dubai, Rashid Hospital. And then we had Tawam Hospital, Al Qasmi Hospital, and other hospital to be certified by that one globally. Then the American Heart Association, we had a collaboration with them to get their standard of care, which has been delivered in the US for stroke care, to be delivered with the same standard in the UAE. More than 2,000 stroke centers is certified by the AHA in the US. The first center outside the US to be certified is in Dubai, in the governmental and private sector. Then we had other centers to be certified by that entity worldwide outside the US in 2019. I'm so happy that we in UAE, we in the health authorities and Minister of Health is leading the stroke care across the region by our team, local and the other helps from our colleagues in the field of medicine. I'm so proud to say that the Middle East North Africa Stroke Organization, the largest stroke umbrella across the Middle East and North Africa, is found in city of Dubai. So that one of the leading achievement that this country, this city, under the leadership of our leaders, we are able to do.
I think huge congratulations for this initiative. What we see that the government and the Dubai health authorities and under your leadership, there are a lot of initiatives which are being taken and the treatment is at par with any other global treatments which are available for this disease. Coming back to the normal people, what we see is we also wanted to understand from you, are there any specific lifestyle changes or risk factors you see in the UAE population that contribute to higher stroke incidence, or and how are we addressing these trends?
This is very important message which should reach everyone, he or she, that there's multiple risk factor, which is a treatable risk factor. If she or he control it, you can make your chance of getting brain stroke so down. Number one, control your blood pressure. Please, who's seeing this video, go and check your blood pressure after age of 35 at least twice a year. Go to your GP, your family doctor, the nearest pharmacy, and check if your blood pressure. If the blood pressure is above 120/80, that's the number which is coming on the screen, 120/80, please go and see your doctor. Do that twice a year after age of 35. Number two, go and check your blood sugar. We know that 25% of the people in our country, in UAE, that they have borderline blood sugar or high blood sugar. They are pre-diabetic or they're diabetic. Please go and check your blood pressure at least fasting or every what we call it, the hemoglobin A1C, once every year. And if there's a blood sugar problem, please start treating this and visit your doctor. Number three, check your cholesterol. It's very common that we will find that young people in their 30s is having high cholesterol and they are not aware about it. So these are the three one. The fourth one, which is exercise. It has been found very clear by many international studies and local studies that if you do 3 days per a week, half an hour fast walk, just you don't need to jog, just half an hour of fast walk, you decrease your risk of getting high blood pressure, high cholesterol, high diabetes, risk of stroke by 50%. 3 times weekly. If you can do more vigorous sport, that will be better. The last one, which is very common, and I can see this very common, our young population, smoking. Smoking is a big issue for high blood pressure. Smoking is very high risk factor for getting a brain stroke. I will advise everyone to come down with their smoking habit or to stop smoking. You can do better for your life, for your family by stop smoking.
Can you share one success story and highlight the life-saving importance of timely stroke treatment which has been given by the stroke center?
One of the things that I'm so proud about, 29th of May, we had a young patient who came to our stroke unit at age of 29. He was giving a bath for his daughter. He has two daughters, one of them at age of 5 at that time, and the other one is age of 7. During that shower, he had sudden facial droop, slurred speech, then he collapsed on the ground. The daughter started to scream. The wife came. She noticed that there's something wrong with the husband. She said at the beginning, I thought that he's making a joke, but it was a real stroke. So they called the ambulance. The ambulance came within the 10 minutes. They know what to do. They took the patients directly to the nearest stroke center. The good story is patients came to the right place within the right time and he received the right treatment. Today we saw that gentleman who was
Absolutely.
bedridden, who was unable to speak, who was unable to stand, neither to take care of himself. That gentleman has a master of engineering. Now he's back to work. Now he's back to his family. Now he's a father of 3. Now he owns his own life. Stroke can destroy the life of the victim. But if patient came to the right place in the right time, we can treat and help that stroke victim to become a stroke hero.
Thank you so much, Dr. Suhail, for talking to us and for sharing these insights with us to create more awareness for the stroke.
Thank you.
Thank you.